If you've ever taken an anatomy course that's focused on the abdomen and the pelvis, you would have most likely been taught about the venous drainage differences between the left and the right gonadal veins. The right gonadal vein will drain directly into the inferior vena cava, and the left gonadal vein will drain directly into the left renal vein. Now, the reason why it's important to understand these differences is for several reasons. Number one being the risk of a varicocele formation in the left gonadal vein is higher due to its long course and higher pressure that it exhibits. Now, things like the superior mesenteric artery compressing the left renal vein exacerbates this effect, and this is what we know as the nutcracker syndrome. The other reason why it's important for us to understand these patterns is that these patterns can allow us to predict the way that cancer can spread hematogenously. So any cancer cells within the left gonadal vein can seed themselves into the left renal vein, perhaps causing renal metastases or a renal vein thrombosis before accessing systemic circulation, whereas on the right side, the right gonadal vein has direct access to the IVC and therefore systemic circulation. Now, one common question that is asked about this particular topic is, why is there a difference between the right and the left gonadal vein? The reason why this happens is, of course, everybody's favorite topic, which is embryology. Now, I know you're tempted to scroll, but just hang in there. As the embryo develops its venous system, the venous system starts off as a scaffold, and most importantly, it starts off symmetrical. Now, let's look at these subcardinal veins over here. Now, these subcardinal veins are really important because they are the veins that initially drain the gonads and the kidneys. Now, as the embryo develops, the symmetry starts to disappear. For example, the right subcardinal vein becomes a part of the IVC. And here we start to see that the right gonadal vein maintains its relationship with this right subcardinal vein that is now the IVC. On the left side, the left subcardinal vein doesn't persist like the right one. So what ends up happening is the left gonadal vein will end up draining into the left renal vein. Now, sometimes in about 0.2 to 0.5% of the population, the left subcardinal vein is the one that persists and the one that ends up contributing to a large part of the IVC, while the right subcardinal vein regresses. And this is what ends up being a left-sided IVC relative to the abdominal aorta. And the most common variant of this left-sided IVC is that it will start off on the left side and it will receive the renal veins. And at the level that it receives the renal veins, which is around L2, it will then cross anterior to the aorta and then to the right side or to the right of the aorta so that it can end up in the right atrium of the heart. Now, these variations are usually asymptomatic and they're found on imaging incidentally for evaluation of other conditions.